Hi, I'm Dr. Claudia Kim. Today we're going to be talking about a breast reduction. Some women may be blessed or cursed with having larger breasts, and a lot of times you can see a familial distribution. So like if your family members have had larger breasts, then unfortunately that was passed on to you. A lot of the times you will see people complaining about back pain, about neck pain, about not being able to exercise comfortably. They're wearing multiple bras just to have a support while they're moving around and jostling around. They'll have commonly the indentations from their bra straps on their shoulders. So for some individuals, this can be quite daunting and pretty much a hindrance to just their daily activities, because that they can have a significant amount of weight just weighing on the front part of their chest. Depending on when you want to address the issues, obviously you do want to wait until you have fully developed. Some young women can experience these issues at a younger age and may be forced to have the surgery a little bit earlier, but if you can wait until after you're fully mature in terms of your development, it is ideal to do so. In an ideal situation, you do want to wait until having kids to do a breast reduction surgery, just because pregnancy can change the shape and the size of the breast, especially if you're breastfeeding. However, if your breasts are so large that it is really impairing your lifestyle, then you can consider doing it before having children, with the full understanding that you may need to do additional procedures in the future. When it comes to when can you do the breast reduction surgery after kids or after having breastfed, it is recommended to wait 6 months, just because your breasts do go through changes with lactation and pregnancy. So give your body a chance to heal and rest before having some kind of intervention done. Now, what is involved in the recovery process after a breast reduction? So you go under general anesthesia, which means that you are sleeping throughout the surgery. And then afterwards, people are actually kind of surprised how not uncomfortable the surgery is. A lot of the times patients do fine with doing over-the-counter medications such as Tylenol and Advil. A little bit more sensitive people can take stronger medications for a day or two, but they actually do very, very well when it comes to the recovery. Now, how many days you have to take off? It really depends on what your job entails. If your job is a little bit more physically involved, then we may have you take off up to 2 weeks. But if you are mostly at a desk position, in a sedentary position, you can actually take about a week off and then return to work the following week with no issues. Now, I often get asked if I need to put drains in. So this is really surgeon dependent. So drains are a clear tube that comes out, and I always like to use my handy, phone charger. So it's a little small tube like this that comes out from the side of the breast, and then it collects fluid into a bulb, or my little grenade. Now, usually drains will come out in about 3 to 5 days, and really is surgeon dependent. So for me personally, I'll leave drains in for very large reductions. For smaller reductions, not so much, but again, that is surgeon dependent. And the drain management, I know it sounds a little bit daunting, but it's quite easy to do. There is a little cap here that you empty out, you squeeze out the fluid, and then you recap. Okay, but if you have any questions, just make sure that you are in contact with your surgical team, just so that there's no confusion on how to deal with the drains. Other recovery expectations or limitations. So I do recommend not doing any exercise or any kind of intense physical activity for about 3 weeks, including running, cardio, weightlifting. You can walk as much as you are comfortable with. Obviously, listen to your body for any cues, because it will tell you if you're not ready to do something and you need to back off. Okay? But a lot of the times people are kind of surprised at how comfortable things are after a surgery, even with a large reduction. But again, make sure that you do have a pain management regimen set up with your surgeon. A lot of the times, people who've had breast reductions, the most common complaint is that not enough tissue was removed. So obviously there are pros and cons about taking a significant amount of tissue versus not taking enough. Now, if you do want to maintain a significant volume, if you want to stay on the larger side, you are having that continued weight upon the chest. Now, as we get older, we lose the collagen and the elasticity of the skin. And so if you want to stay big, that weight of the breast is going to continue to stretch out the skin. So take into consideration that if you're only taking off a little bit of tissue, then you're going to continue to go down. Even when you take out a significant amount of breast tissue, your breasts are still going to sag just because of the changes in the skin that we see. So take that into mind when you ask for how much tissue and what size you're going to be afterwards. For the healing period, a lot of the times because of the initial swelling, the breasts appear larger, right, after surgery. And then after a couple of months, usually about 6 months, is when all the healing and all this, the swelling subsides, so you can get an accurate size after that period of time. So definitely don't get sized for a bra until after 6 months, just because your body does go through the inflammation and the swelling process. So you may not be at your final baseline or your final bra size until after 6 months. Other garments that I do recommend is to avoid an underwire bra, because the underwire can actually put a little bit of pressure along the incisions. So either wear a surgical bra, or you can wear a light to medium supportive sports bra. And obviously, if you are continuing your exercise or resuming your exercise after 3 weeks, make sure you wear something supportive so that there is not too much movement and shifting around while you are moving. Depending on the breast position and how much tissue you are removing, the incisions will vary. So sometimes you'll see what's called a lollipop incision, or the lollipop is where the incision goes around the areola and it goes vertically down, or the anchor position, which is pretty much the lollipop with an added horizontal line underneath. Now, how long is a horizontal incision? That really depends on how much breast tissue there is and how much extra skin there is. So if there is not that much extra skin, then that incision on the horizontal aspect may be a little shorter. But if you are experiencing, or if you do have some extra skin out to the side here, then that incision will have to lengthen out towards the side, just so you can remove the extra bit of skin. And obviously, if you are combining it with other procedures such as, massive weight loss, you can do that in conjunction with commonly like an arm lift or a bra line lift or back lift. Hope you guys learned a lot about breast reduction. Stay tuned for more videos like this.